right?
August.
You mind telling us your age?
65.
You're 65, okay. And you've been having knee problems for a long time. And you've had to have it drained even once before, right?
Just since the getting everything finalized for the
surgery. Okay, all right. You called your orthopedic doctor and they didn't reply.
But I left a message.
Yeah, they didn't call you back. Well,
They always do that.
well, we're going to help you out. Well, that's not very nice. I don't like it that they always do that. So you've got a lot of fluid on this knee to the point where your knee joint is actually hot. All right, that's inflammation. Your knee joint is also tense. The fluid buildup is very tense, and you're tender. Now I do need to find some landmarks here. So here's the patella. It's very difficult to see, but the patella is right in this area. So what I'm going to do is I'm going to take and I'm going to make a little mark right where we're going to go in to get the fluid, right here, okay? That's our spot.
Okay.
And you're okay if we video your procedure for all our friends on YouTube?
Sure.
All right, I appreciate that.
Betadine?
Yeah, a little betadine, please. We've got the Gumby Jean helping us out today. You're our last patient of the morning this Thursday.
Yes.
You got plans for the weekend? King Cole? This is King Cole, Gumby Jean.
King Cole.
King Cole. I know you have plans for the weekend.
I got plans, but if the knee kicks me out, then
Well, we're going to hope that the knee doesn't kick you out. Now, the next part of this
I got to work.
You got to work.
Yeah.
We're going to do a little bee sting on you here, okay? This is just a little numbing medicine. This isn't the actual spot where we withdraw the fluid, okay? So this is just a little numbing. There you go. That's all. All we're doing, Mike, is didn't mean to use your name, my friend. Well, no, wait. Mike's pretty common. I don't think we're worried about that. We're just raising up a little bleb so that it doesn't hurt when we put the needle in. All right. So now we've got a big 60 cc syringe, and we're going to see if we can get some fluid off of here. We're just going to insert it, and then we're going to draw back, and we're going to start getting this fluid. Now, if you heard a whole bunch, you're going to tell me. So this is what we would call serosanguinous. Gumby Jean, I may need your help.
Okay, what you need me to do?
Well, we may actually get more fluid off of here than this syringe is going to hold.
You need another one?
And we might need another one. Also, you could kind of massage the knee a little bit and push that fluid up. Just a little bit. You feeling okay, partner? Try to relax. That's the biggest thing here. Sometimes just taking off 30 or 40 cc's of fluid, which actually is quite a bit.
They took 40 last time.
Did they take 40? Well, we're going to try to beat that. Especially since they didn't call you back this time. Now it's already feeling looser. Definitely, look at that. Now,
it was tight.
It was really tight.
Okay. You know, I have one of those Cajun injectors for my turkeys. I was going to use that.
The Cajun injector? I think those are just turkey basters is what that thing is called. That is.
Oh, sorry.
Gumby Jean's a Cajun, you know. You have to be
I
careful.
know. We talked about it.
Yeah, she's a Cajun.
Yeah.
So, yeah, now that feels a lot better. So, we've got about 35 cc's, so we got to work a little bit harder. We got to at least match what they got before.
There's only 40.
Yeah, you see that fluid is all the way up in there. Sometimes it gets loculated or trapped a little bit. Now we're at 42. Let's get a little bit more out of there.
Now they call this thing the meniscal.
Well,
you've got. I tore that thing 25 plus years ago.
Yeah, you've got severe osteoarthritis.
Yes, I do.
I completely understand that you definitely need to have a knee replacement. All right, Gumby Jean, if you'll get the hemostat, we'll give. I think you need a little cortisone to make your weekend a lot better. So, and it's not going to make your knee any worse. You already know that you need to have a replacement. So we're not going to make things any worse.
No, it's okay. Yeah.
But
nothing there. Nothing there. Should I be taking some kind of arthritis stuff?
At this point, it does not matter.
As you can see, sometimes my wrist will get like that big.
As far as your knee is concerned, the knee is lost. You're going to get a new knee. And in taking a daily anti-inflammatory can actually increase your risk of heart disease and heart attack, stroke, those kind of things. Oh, that's tender, huh? Sorry about that, bud. All right, so she's going to spray it, and we're just going to give you a little bit of cortisone in there.
Okay.
Little stick.
Okay.
Just try. We got to relax that knee. There, just relax.
Okay.
I think it's just a little bit more scary than it is painful. That didn't hurt, did it?
No, sir.
All right.
Didn't feel a thing.
You just jumped a little bit. All right. So now we got some cortisone in there, and that's going to make your weekend better. It's Thursday, but so tonight about an hour before you go to bed, I'd like you to ice your knee for about 20 minutes, okay?
Yeah.
Just 20 minutes, ice it up, and you should get a decent night's sleep. Tomorrow, this knee should feel a lot better. Now, some of that fluid's likely to return.
Sure,
But
it did.
the cortisone will help kind of slow that process down.
Okay.
When the orthopedic doctor calls, tell them you had to get it drained at your primary care doctor's office, and they'll understand. But tell them you still want to get the knee. Tell them you still like them. You just wish
If
they
I can hold off till August,
Well, tell them. Well, that's not
I
that
might
far
go-
away.
I might go elsewhere.
That's well, that's your choice. But thank you for letting us video your procedure.
Stay tuned for the Meta 7 video. I took mine. How about you?
Coconut loves Meta 7, okay? Because look, I could not get comfortable for anything last night. I went to sleep at 1 o'clock this morning, woke myself up around 5, and I have been knocking patients out all day nonstop, and I still have a whole mess of energy. Thank you, Dr. Gilmore, for making Meta 7.
Okay, so you took Meta 7 this morning.
Yeah, I
And
take
it's
it every
just-
morning.
You take it every morning. And so even though you had a hard time sleeping last night, you took Meta 7 this morning, and now you are a medical assistant machine.
I am a machine. I'm a tank.